Cancer. It's a word we never want to hear. In 2012, my boyfriend Dax and my mother Tammy were both diagnosed with leukemia. I'm going to speak to you today about the demon that has forever changed my life. Leukemia is a cancer of the blood and bone marrow. Bone marrow is made up of stem cells, myeloid stem cells, and blasts. Blasts are found in healthy people as well, 0% to 5%. Anything more than 5% is cause for concern because it indicates leukemia. If you have leukemia, the first thing affected are your white blood cells. White blood cells are your infection fighters. If you have leukemia, your white blood count will be very, very elevated or almost non-existent in the very aggressive stages. Also affected are your red blood cells. Your red blood cells carry oxygen from your lungs throughout your body. If you lack red blood cells, you most often get anemia. Another thing also affected are your platelets. Platelets are fragments of cells that help control your bleeding and bruising. If a doctor suspects leukemia, they often refer you to an oncologist. An oncologist is a doctor that specializes in cancer. The first thing your oncologist will ask you are your symptoms: fever, rash, weight loss, loss of appetite, red dots on your body, pale skin, reoccurring infections, and it'll be hard to breathe. The way they determine if you have leukemia is they do a bone marrow biopsy. If a patient isn't put to sleep, it is a very, very painful process. They take a 12-gauge needle and stick it into your hip and extract the bone marrow and take out a piece of your bone. Once they confirm the leukemia, they look further into that bone marrow to determine what type of leukemia you have. There are 4 different types, 2 acute and 2 chronic. Acute lymphoblastic leukemia, most often found in children, but can occur in adults too. Acute myeloid leukemia, which is the most aggressive form of leukemia. Chronic lymphoblastic leukemia, which is the most common form of leukemia. And chronic myeloid leukemia, which is just a slower version of the AML. There are 3 types of treatments, one being chemotherapy, one being a steroid therapy, and then another one being a stem cell transplant. With the stem cell transplant or the bone marrow transplant, they use high doses of chemotherapy to remove your immune system and replace it with somebody else's immune system. What they do is they basically do something like a biopsy as well and take it out of either a related donor or unrelated donor. If it's a related donor, it's usually a sibling or a close relative. They also can use umbilical cord blood. After your transplant, they put you on various amounts of medicines. These are Dax's. He's on antiviral, antibacterial, magnesium, pain meds, multivitamin, and this medicine called tacrolimus. Tacrolimus prevents graft versus host disease. Graft versus host disease is what happens whenever the immune system starts attacking itself. It can be very dangerous if it gets into your organs, but if you use your tacrolimus, it'll most likely not happen. A high risk factor is called a mutation. The most common is FLT3. Dax has the FLT3, but thankfully they've come up with an inhibitor called AC220. He takes this. It's a shot. He says it's very gross, but I mean, it saves your life. If he didn't take that, his cancer would return. There's no ifs, ands, or buts about it. It affects over 150,000 people a year, only in the United States. The risk factors for leukemia include air pollution, smoking, and family history. There is a quote I'd like to share, and we'll end my speech on that note. It's from the movie Coach Carter. It's called Our Deepest Fear. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, and fabulous? Actually, who are you not to be? You are a child of God. Your playing small doesn't serve the world. We were born to make manifest the glory of God. That is within us. It's not just in some of us. It's in everyone. And as we let our own light shine, we are unconsciously giving people permission to do the same. As we are liberated from our own fear, ours presents automatically liberates others. Until next time.